The Himalayan Cataract Project Cure Blindness has also waded into the conversation about Ghana's parliament enacting a law for organ donation, harvesting and transplant. These, it says, are an essential medical intervention to improve the quality of life of patients, avoid deaths and reduce costs. Passing such a law would also enable the establishment of banks to store vital organs such as cornea, kidneys, liver and heart, bone, marrow, among others. The call was made when the HCP Cure Blindness team conducted free eye surgeries for some 500 patients in partnership with the EYEBANK hospital at SENYA, BREKU.
With a burden of chronic non-communicable diseases in the country, organ transplants become a life-saving intervention. For instance, sickle cell patients require the bone marrow of a healthy donor to live freely of sickle cell diseases. Chronic kidney disease patients would also need to replace their kidneys with those of healthy donors, and same can be said with the other organs. The Korle-Bu Teaching Hospital and the Greater Accra Regional Hospitals have in recent times undertaken organ transplants successfully using organs donated by relatives of patients. Yet, these milestones do not have the necessary legal backing mandating such procedures.
It is true that as a country we don't have legislation, and I know a lot of my predecessors have done some work on trying to get the legislature passed. In March, we were able to organize the first Cornea Summit. And with that summit, we were able to bring the government and the private and all people in eye care together to discuss the way forward. So from that Cornea Summit, we started working on legislature to build a draft. The draft has been completed.
The visiting Himalayan team, as part of its outreach, has also performed cornea transplants at the Korle-Bu Teaching Hospital and trained its staff in the procedure.
In this country, some way, somehow, we've managed to train 4 cornea surgeons. But the cornea surgeons need tissues to work with, and therefore, anytime the Himalayan Cataract Project team is coming, then they have to carry the tissues from the US, from Nepal or from Ethiopia straight to Ghana to come and do the surgery. And we think that that is a lot of cost.
Cornea blindness is highly prevalent in Ghana, and due to the absence of such tissues to cure such blindness, there are calls to have an eye bank to restore the vision of persons who need not be blind.
We've now trained 3 excellent young doctors here in Ghana to perform the surgery. But there's no eye bank, there's no tissue bank, so that there's no donation of that little tissue that will restore perfect sight to the tens of thousands of people who are blind from cornea disease.
How beneficial will these banks be?
To enhance the image of this country, in the sense that now the tissues that we'll be using are tissues that we harvest them locally. And therefore, once you harvest those tissues, the tissues are very healthy. They are very strong. The outcome of that surgery is very good. Now, the ones that usually come in from outside would have been about 1 week or 2 weeks before they arrive. And when they do arrive, we have to rush to the theater to go and do the surgery. So the outcome cannot be compared with the tissues that have been harvested maybe a day or 2 days or 3 days. And then also the outcome for the patient will be very, very good. Yes.
Okay, and obviously this is going to also cut down on the cost of traveling abroad to have such surgeries done. So we are calling on the Health Committee of Parliament to fast forward this legislation, this bill, to ensure that it is passed so that Ghanaians would have the benefit of its personnel in terms of health care.